I'm Josh. I go to Northeast Ohio Medical University, currently a second year.
I'm Samantha. I'm currently a second year at the Cleveland Clinic Lerner College of Medicine at Case Western Reserve University.
Okay, so for my first question, what have you guys learned about holistic healthcare in medical school?
Yeah, so what patients are really wanting from their experience with their physician is to be heard and focus on a lot is making sure that our conversations are like focused on not only like what's going on, like when did pain started, how much does it hurt, but like how's that impacting your life?
Talk about holistic medicine a lot more. We go and we interview standardized actors, and we learn how to build relationships, ask questions about their home life, like not just make them feel a part of the team.
Okay. Do you think that patients right now are treated right with holistic care? Do you think
doing a job, the quality of care that they can give can be very different from, what between colleagues. Even at the same hospital, the care that a patient could get can be extremely different. And it's also different by specialty. So
yeah, I think a lot of it comes down to time. Depending on how much they have in the interview, they can take a holistic approach or not. Like sometimes you have to really focus on symptoms, signs, and you kind of leave some of those other more social factors to the social worker, or they bring it up if it's important. Like it's this thing called longitudinal clinic where I go every week and work with a primary care provider. And when I work with them, the appointments are longer. And so the patients are there longer, they talk to me longer, they talk to their doctor longer, and all of them seem to really like it because they get more attention and they can talk more, and they don't feel as rushed and I think that that's a lot of what the problem is in integrating a lot of this holistic approach, is that a lot of people just don't have the time. And it sounds bad, but the patient load just goes up.
Have you guys ever gone to the doctor and felt like you were being treated as more of a problem instead of just like a person?
I know family members who have. For example, a family member of mine who was experiencing neurological symptoms went to a neurologist, and they basically called them a bored housewife when they really had multiple sclerosis. And they went to a different doctor, and they actually asked more questions and treated them with respect, and took everything they were saying into account. Made the diagnosis, and they got treatment, thank God. But there are doctors out there that will discount patients and not listen to the whole story, because when you do dig deeper, sometimes in that social history, in those things that you might not normally ask about, there are clues that could help you help the patient.